Hello viewer, hujambo. Welcome to this GTN Nursing Services YouTube channel where I, Grace the Nurse, talks about mother and child health care. We are on our fourth series whereby we are talking about family planning program in Kenya and the reason as to why family planning program is important to an individual. If you have watched the other clips, I'm sure you'll be able to understand what we are talking about here. Thank you. So, what are our learning objectives of today? They include understanding the importance of male engagement in family planning. Understanding the importance of male engagement in a family planning program. And then number 2 is to understand when to discontinue using a family planning method or a contraceptive. And then number 3 is to understand the returning to fertility after use of a family planning method. Returning to fertility after one has used contraceptive method. So on our first learning objective about engagement of men in a family planning program, we are told that it is important for males to be engaged in family planning program because it helps to empower them in family planning information and demystify the myths associated with the myths and the misconception associated with contraceptives. You know, outside there, when people are giving their own stories, they talk a lot about family planning methods, that they do 1, they do 2, they do 3. So these are the myths we are talking about. They are the misconceptions. So if one is after a family planning method, it is very important to involve the partner so that when counseling is being done, it can be done for both. We are told that when this one is done in the presence of a male, it also helps to support the spouse in decision making on the desired number of children, leading to a healthy outcome for the family. You see, when men are involved in a family planning program, it has 2 things, important things that happen. That is number 1, it helps to demystify myths and misconceptions about family planning. And then number 2, it helps them to join their spouses in decision making on the desired number of children, leading to a health outcome for the family. So that is about our learning objective number 1. On the learning objective number 2, about discontinuation of a family planning method. Rather, when to stop using a contraceptive method. We said contraceptive comes from the word conception. If contraceptive is not used, conception takes place and it ends up in a pregnancy. But when one is using a method, we say one has acquired a contraceptive method. So when to stop? One can stop if they want to become pregnant. Yes. One can stop if they no longer become pregnant, like women who are menopaused. One can stop if they are not sexually active. And one can stop if one has a medical condition or a surgical condition that does not allow the use of a contraception. Like maybe a woman has been done an operation whereby the whole uterus is removed. That means this woman, she cannot become pregnant after the removal of the uterus. When somebody is not sexually active, the same way, you don't need to use a contraception. If you can no longer become pregnant, you have become menopaused, no need to use a family planning method. And if one wants to become pregnant, that is the time you stop using the contraceptive method. Okay? Higher. The running objective number 3, returning of fertility after use of a contraceptive method. Yes? Stories outside there, people say when you use, you will not become pregnant again. But what does the policy guideline tell us? It is telling us that return to fertility after contraceptive method, if not irreversible method, prompt return to fertility after discontinuation, though there may be slight delay, will take place between 3 to 6 months. But sometimes it can go up to 12 months, depending on the method that one is using. So, if there is delay in return to fertility after 12 months, the underlying cause should be investigated. Because as long as the method one has been using is not irreversible. You remember when I was saying one can use the methods to delay a pregnancy can be using a method. The way one can delay a pregnancy is either by using a method, a procedure, a device, or changing behavior. So let's say that one has changed the behavior. It means automatically when you want to become pregnant, you become pregnant. If one is using a device, it means if that device is removed, automatically one will become pregnant. We will go back to fertility. And if one is using a method, when that method is stopped, fertility will return. But if someone is using a procedure, because that is where I didn't want to elaborate more. A procedure means a surgical intervention has been done on you as a method as a method of family planning. That one is irreversible, and therefore return to fertility cannot be present. But all the other methods, as long as one has stopped, we are told that return to fertility is very easy. If delay takes place, that means investigations should be done. Okay? And I think that is the last clip for us on this family planning method. Next time we will see what other lesson we are going to learn about. Thank you for being having subscribed to this channel, whereby we keep updating mothers on information that is found necessary for them during this time of childbearing age. Thank you. Subscribe, thumb up, comment, and share with friends. Thank you.